It is a quiet Tuesday morning. Margaret, 72 years old, pours her coffee and walks to the kitchen table. She sees the white envelope. She has been dreading it for weeks. She opens it slowly. Her hands begin to shake. Her Medicare supplement premium just went up by 24%. She does the math. That is almost $200 more a month. Her entire Social Security raise for 2026 gone, wiped out before February. So she does what any smart senior would do. She picks up the phone and calls another insurance company to switch to a cheaper plan. And that is when the agent says the words that change everything. "I'm sorry, ma'am, you'll need to answer some health questions first. And based on your medications, we cannot offer you a policy." Margaret is trapped. And right now, in 2026, millions of American seniors are walking into the exact same trap without even knowing it. Hello, my friend. I am Milena. And if you are 60, 65, 70, or older, what I am about to share with you in the next 10 minutes could save you thousands of dollars and protect the medical coverage you have worked your entire life to earn. Today, I am going to show you exactly what the federal Medicare rules actually say in 2026. Not rumors, not opinions, the real rules. Straight from Medicare.gov, the Kaiser Family Foundation, and AARP, I will explain the one window of time when you have full power to choose any Medicare supplement plan you want. I will show you what happens the moment that window closes. And I will give you a simple 3-step action plan you can use this week to protect yourself. But please, stay with me until the very end. Because there is one hidden mistake, a mistake that most retirees do not discover until they are sick and desperate, that can lock you out of affordable coverage for the rest of your life. I will reveal it before we finish, so pour yourself a cup of coffee, sit back, and let's protect your future together. Let me tell you about Robert. Robert is 67 years old. He is a retired postal worker from Richmond, Virginia. He worked 38 years. He played by the rules. He paid every Medicare tax taken from every paycheck. When Robert turned 65, he had a choice to make. Original Medicare, with a supplement plan, or Medicare Advantage. The Medicare Advantage commercials looked wonderful. $0 premium, free gym membership, dental, vision, even a small grocery card. Robert thought, why would anyone pay extra for a supplement when this is free? So Robert chose Medicare Advantage, and for 2 years, everything was perfect. Then, at age 67, Robert was diagnosed with type 2 diabetes and a heart condition that needed regular specialist care. Suddenly, his Medicare Advantage plan started saying no. No to the cardiologist he wanted. No to the hospital across town. Prior authorization denied. Referral required. Network restrictions everywhere. Robert thought, that's fine, I'll just switch back to original Medicare and buy a supplement plan like my neighbor has. He called 3 different insurance companies. All 3 asked the same health questions. All 3 said the same thing. Mr. Robert, based on your diabetes and heart condition, we are unable to offer you a Medicare supplement policy at this time. Robert was stunned. He said, but I have Medicare. It's my right. And here is the painful truth the agent told him. Outside of one specific 6-month window when he first turned 65, Robert had no federal right to buy a Medigap plan. None. He had walked through a one-way door at age 65, and he never knew the door locked behind him. Today, Robert is stuck. He pays full 20% of every doctor visit, every specialist, every test, with no out-of-pocket limit at all under original Medicare alone. Robert is not a careless man. He is a smart man who was never told the rule. And that, my friend, is exactly the trap I am about to help you avoid. Let me walk you through what is actually happening in 2026, in plain English. First, the numbers you need to know. The standard Medicare Part B premium in 2026 is $212.90 per month. That is up from $185 the year before. The annual Part B deductible is now $283. That is a more than 10% jump in just 1 year. There is some good news. The new Part D prescription drug out-of-pocket cap is $2,100 for the year. Once you spend that much on covered drugs, you pay nothing more until January. But here is where most seniors get blindsided. The Medicare supplement plans, what we call Medigap, are seeing premium increases of 18 to 25% or more in states like Virginia, Washington, and South Carolina this year. And that is the panic call I am getting every single day. Now, the rule that matters most. Federal law gives you one and only one golden window to buy a Medigap plan with full protection. It is called the Medigap Open Enrollment period. It is 6 months long. It begins the very first month you are both age 65 or older and enrolled in Medicare Part B. During those 6 months, and in only those 6 months, federal law guarantees 3 powerful rights. Number 1, you can buy any Medigap policy sold in your state. Number 2, the insurance company cannot ask you a single health question. And number 3, they cannot deny you, charge you more, or make you wait because of pre-existing conditions like diabetes, cancer, or heart disease. After those 6 months end, the protection disappears. Federal law no longer guarantees you the right to switch. In most states, insurance companies can use medical underwriting. They can deny you, they can charge you double, or they can make you wait up to 6 months before they pay for anything related to a pre-existing condition. The 4 big traps seniors fall into. Trap number 1. Many seniors believe they can shop around for a new Medigap plan every fall during the Medicare Annual Open Enrollment, October 15th through December 7th. This is false. That window is for Part D and Medicare Advantage only. It does not apply to Medigap. The Kaiser Family Foundation confirms this very clearly. Trap number 2. This is Robert's trap, choosing Medicare Advantage at 65 and trying to switch to a Medigap plan years later when your health declines. Outside of a special 12-month trial right, the very first time you join Medicare Advantage, there is no federal guaranteed right to go back. KFF research shows insurers can and do deny these applicants regularly. Trap number 3. Believing your Medigap premium will stay the same. It will not. Premiums rise every year due to age, inflation, and claims, and in 2026, those rises are historic. Trap number 4. Mixing up Medigap and Medicare Advantage. They are completely separate. You cannot have both at the same time, and the switching rules are not the same. The legal protections you do have. Now I want you to know your rights, because you have more than you may think. You have the 6-month Medigap Open Enrollment period at age 65. Use it well. You have guaranteed issue rights in specific situations. If your insurer goes bankrupt, if your plan terminates, if you move out of your plan's service area, or if you lose retiree coverage from a former employer. These give you a 63-day window to buy certain Medigap plans without underwriting. You have a DACOPORS 12-month Medicare Advantage trial. Right. The very first time you ever join an Advantage plan at 65. If you don't like it, you have 1 year to go back to original Medicare and pick any Medigap plan you want. You have a 30-day free look period. When buying a new Medigap policy, federal law lets you cancel and get every penny back. And if you live in Connecticut, Massachusetts, Maine, or New York, your state requires Medigap insurers to accept you year-round, regardless of your health. Several other states like California, Oregon, Missouri, Washington, and Idaho have a birthday rule, allowing a limited annual switch without underwriting. Finally, if your income is high and you are paying IRMAA surcharges on top of that $290 premium, you can file EPOM's Form SSA 44 with Social Security after a life-changing event like retirement and ask for a reduction. These are not loopholes. These are your federal rights. But you have to know them to use them. So what should you actually do this week? Here are the 3 steps I want you to take. Write these down. Step 1. Find out exactly where you are in the Medicare timeline. Log into your account at medicare.gov or call 1-800-MEDICARE. Confirm your enrollment date in Part B. If you are within your 6-month Medigap Open Enrollment period, this is the most powerful time of your Medicare life. Use it. Compare every Medigap plan in your state. Pick the strongest one you can afford, because this window will not come back. If you are past that window, find out if your state has a birthday rule, an anniversary rule, or year-round guaranteed issue. That information could save you thousands of dollars. Step 2. Before you change anything, call your state health insurance assistance program. This is a free service. Every state has one. Trained counselors who do not sell insurance will look at your specific situation and tell you, in plain language, what your rights are and what your real options are. Do not make any Medicare decision based on a TV commercial or a phone salesperson. Always confirm with SHIP first. The number is on medicare.gov. Step 3. Build your Medicare paper file today. Gather your Medicare card, your enrollment confirmation letters, your current Medigap or Advantage plan documents, your prescription list, and copies of any premium notices. Keep them in one folder. If you are ever denied coverage or hit with a surprise charge, this folder is your evidence. And if you need to file Form SSA 44 to lower your IRMA surcharge, every document you need will be right there. 3 steps. 1 afternoon of work, a lifetime of protection. My friend, before you click away, I want to say one more thing, and please listen carefully. The Medicare rules are changing faster than ever in 2026, premium hikes, underwriting changes, new IRMA brackets, new Part D rules, and by the time YouTube shows you a video about it, the deadline may have already passed. You cannot afford to rely only on YouTube notifications for something this important. The algorithm does not care about your retirement. I do. That is why I created the Global Senior Alerts official WhatsApp channel. It is completely free. When you join, you will get real-time alerts the same day a rule changes. Social Security updates, Medicare deadlines, pension news, bank regulations, insurance warnings, even airport rules for senior travelers. And as a thank you for joining today, you will get instant access to my free Senior Benefits Protection Guide, a simple PDF checklist you can print out, fill in, and keep on your refrigerator. It walks you through every right we discussed today, plus the exact phone numbers and forms you may need. Just click the link in the description below this video. It takes 30 seconds, and it could save you thousands. If this video helped you today, please give it a thumbs up. Share it with a friend, a spouse, a brother or sister who is on Medicare. They deserve to know these rules too. And subscribe to this channel because next week I am breaking down a new Social Security rule that almost no one is talking about. Until then, stay informed, stay protected, and remember, your benefits are your right. Nobody fights for them harder than you do. This is Milena. I will see you in the next video.